So I'm going to go ahead and start with the Provisional. And I'm going to apply a little bit of Vaseline. Not too much. Keep in mind that if you're working inside a patient's mouth, you don't need to Vaseline the tooth preparation because saliva is a nice biofilm, and that prevents adhesion of temp base onto your tooth preparation. But because we're in an in vitro type of setting, you will need to place a little bit of Vaseline along your prep to prevent temp base from sticking. I like to use the thermoplastic stent. Putty works just as well. Alginate impression works well. Alginate works well. Any type of impression that you took before you actually started the prep will work. And temp base is a pretty nice material. One thing that you have to be careful when you're working with temp base is that you can actually make it really, really thin. And sometimes it gets to a point where you can't see it layered on the adjacent tooth. So make sure that after your provisional's been made and before you check occlusion, make sure to run an Explorer over so that you don't have flashes of temp phase on the occlusal surfaces of the adjacent teeth. So I'll just go ahead and pass my Explorer along, make sure that there aren't any clumps or puddles of Vaseline on the tooth preparation itself. And remember, you just want to create a nice thin film. You don't need to put a blob or, not too much. I made a thermoplastic stent, and there is a hole, if you can't see it, but I punched a hole mesial buccal, mesial lingual, distal lingual, and distal buccal. So that will allow the material to escape. And you notice I have good adaptation. This isn't rocking, and it's nicely secured. So now I'm going to go ahead and load the temp base into my stent and make my provisional restoration. So something that I do in addition to loading the temp base is I'm usually very careful not to trap an air bubble when I'm loading my temp base into my thermoplastic stent. The worst thing that you can do is have a really nice provisional and have a really giant bubble right in the middle of your provisional. Now, in addition to loading the tray, what I also like to do is go ahead and marginate by putting a little bit of temp base along the provisional finish line as well. And what this does is it creates a nice margin without too many voids. And you want to now go ahead and gently place this over. And you'll notice the temp base extruding. And just smear that out. And there you go. Now, one thing that you can do is I'll go ahead and put a little bit of temp base here. And I want to explain to you why this method works here in the sim lab. Keep in mind that inside the patient's mouth, the ambient temperature is about 98.6 degrees Fahrenheit, but out here in the sim lab is somewhere around like 78 degrees. So the environment temperature will affect the setting time of your temp base. And so here, what you want to do is you want to wait until this has a nice resilient condition, like here, and you'll notice that I'm able to peel this off without disturbing the initial form. And this is sort of like the condition that you want the temp base to be in before you start actually try dislodging it off the tooth preparation. One bad thing about temp base is that if you wait too long, it will actually lock onto your tooth and you'll have a very difficult time trying to remove that. So this is a nice condition right here, so I'm going to go ahead and remove my thermoplastic stent and carefully try to dislodge my temp base before it's fully polymerized. And I'm using a cord packing instrument. I'm gently lifting from the mesial and the distal. And you can see I have a lot of extra material. And now I'm lifting here. I'm carefully removing this. A little bit from the lingual as well. You notice that I'm able to remove this before it starts to set. And there you go. So now I have a really nice shell. It's completely intact. Oops. And when we examine it, you notice that I have a really nice finish line all the way around. And that's the result of creating a nice clean chamfer. You notice that I was able to remove it before it completely polymerized, because once it does that, even on a prep without any undercuts, you'll find that it's very, very difficult to remove. So at this point, I'm going to go ahead and wait, allow this to fully cure, and then go ahead and carefully remove the extra material that was the result of using a little bit too much temp base. When we go back over to the prep, you'll notice that earlier I was telling you about just exactly how much temp phase gets onto the occlusal surfaces of the adjacent teeth. And you'll notice that this can and will affect occlusion if you forget to remove these little flash of temp phase. So make sure that you run an Explorer over and be very meticulous about cleaning the adjacent teeth. So you notice that we have a lot of extra material here. And I think that's one of the disadvantages of putty, is that it doesn't have a vent to allow the residual temp phase to escape. And so what you'll end up with is a provisional that's very, very hyper occluding, and as a result you'll spend a lot of chair time removing that. So we'll wait a few minutes, allow this to fully polymerize, and then we'll record how I shape my provisional, and then we'll try it on for checking the margins and occlusion. Alright, so I'm now going to go ahead and adjust my provisional restoration. So I'll get rid of a lot of these bigger chunks. So I'm just going to open up the Ywom braziers here a little bit. And if you do this very carefully, I can see my finish line that I produced here. So I'm going to try to get my burr as close to that without nicking it. And you notice that on the lingual, I do have some transition lines here. So what you want to do is, as you're creating your margin, make sure that you blend these lines away so that you have a nice, clean, uniform lingual surface. So here I'll just go ahead and gently remove. So right now I still have a lot of extra material. You'll notice that my finish line is located right along here. So I'm going to position my burr. And just carefully remove until I get to that mark. And it looks like I'm there.
How do you know where your finish line is exactly?
When you look at your provisional restoration, you can see where that line is. You can tell with your loops. If you look at your provisional with your loops, there is a distinct line that goes all the way around the provisional, and that's how you can tell that that's your finish line there. So I'm going to go ahead and reduce a little bit more. Okay, that's good. So one of the things that I try not to do is put too much Vaseline, because if you put too much, especially along the finish line, that will guarantee an open margin. So be very careful when you're painting the Vaseline over your tooth preparation. Right now I'm working on the lingual embrasure. And remember to preserve your finish line as much as possible. And normally if I had a pencil I would mark exactly what my contact point would be, but that would be my contact point right here. So all the areas in the periphery I'm going to remove and shape and make it look like an actual tooth. So I can go ahead and hold my spur in this angle and get rid of all the extra material. And a lot really is just blending away lines and extraneous temp phase material, and you're really just shaping this to make it look like a tooth. And so always angle. You notice that right there is my finish line, because you notice that it was the thinnest part. I'm just going to go ahead and carefully adjust here. Open up the work on the buckle. And again, on the buckle, you'll notice that I have a nice clear finish line right along this area. So that's what I'm going to adjust my provisional to. You notice a big chunk that flew off, but I still have my finish line or my margins intact. So now I'll go ahead and work on the buckle embrasure. And I'm kind of going around in circles and getting rid of any extra areas. Alright, so I have my margins clear. Now I'm working on my contact. Okay, make sure you don't wipe out your contact. Go ahead and blend these lines away. Create my marginal or my occlusal embrasure. Go ahead and shape here. You notice that I haven't touched any of this area, and that's what's going to help me establish my proximal contact. I'll get rid of these little extra areas here. Alright, not too bad. Get rid of these little nodules here. Alright, not too shabby. That looks pretty good there. And so if you want to really impress someone, maybe your spouse or somebody, you can actually go ahead and take a burr and create a nice little groove here just to enhance your... Probably using a burr that's a little bit big, but a number 2 round or a sharper diamond will create a nice occlusal anatomy here. Remember that when you're checking occlusion, try to make sure that you make your reductions nice and clean. And later on, when you polish this with pumice, you'll have a really nice looking provisional restoration. Alright, so make sure there's no residual Vaseline within your provisional. And there you go. So that should be a nice finished product there. So at this point, you would go ahead and check the margins, check the proximal contact, check occlusion. If there's any area that you need to repair, go ahead and do so. I can see that the mesial needs to be adjusted a little bit. But otherwise it's a pretty healthy looking provisional restoration. So we have a provisional on the buckle margin. You'll notice that when I check with my Explorer, there's a definite catch. And you notice that the provisional, I can actually lift the provisional off the tooth. And you'll notice that I have an open margin all along the buckle here. So what I'm going to do is demonstrate to you what I would do to make the repair here. Now, we don't have actual flowable composites, so I'm going to be using blockout resin, which I think is flowable, but the color is blue. And so the first thing that you're going to do is you want to make sure that you put a thin layer of Vaseline. Don't put too much, because then you're being counterproductive, and you won't be able to seal that margin. So I'm just going to put a gentle layer of flowable there. I'm then going to condition the buckle finish line by adding a little bit of Optibond. And so I'm going to go ahead and just paint a little bit along here. Just like that. And so you notice I'm going from one proximal contact to the other. And go ahead and line a little bit here. Again, don't put too much or else it will stick. And so here, go ahead and light cure for 10 seconds. That was a lengthy 10 seconds. And then go ahead and place another layer of Optibond. And then place the flowable on the area that you want to repair. Okay. And then go ahead and seat the provisional back onto your prep. And what this will do is it will extrude the light body. And you can see the extra material extruding out. At this time, you can go ahead and light cure I think some will actually use an explorer and remove that. I don't like to do that. I actually like to shape this extra material away using the diamond burr. Go ahead and cure. 10 seconds. Okay. And then go ahead. Alright, so I'm using a spatula here to sort of dislodge the provisional. And you notice that it's a much nicer fit. We have extra material that's sort of extruded. And this is where I would use my fine diamond and go ahead and make the necessary adjustments. So here. And it didn't take much material, but you can see that there is a trace of blue flowable composite, and that should be enough to seal your margins. So I'm going to put this back, and we'll put this over. I will run my Explorer over the margins, and you notice that, yeah, it's much nicer fit.
Okay, so we're gonna grab the wet wheel and soak it in water.
And usually pretty quick. Okay. So bring over here. And what you're going to do is see right here. So if you do this, and then, okay, so it's locked in. We're going to come over here. Pumice. Right? Pumice. We're going to grab a little bit of pumice. So, 1, 2. Okay, 2. And pumice, when you're working with pumice, you need to add water. And you notice that this is probably too dry. Because you notice that this is, it's kind of like sand.
Grainy.
Yeah, so you want it to be a little bit watery, but not too much. You don't want it to run too much. So this is actually pretty nice consistency here. You can see that it holds form. It's not too dry. So this is a nice, and you notice that if I shake it, it creates a nice smooth glossy surface. Okay, so here. On the wheel, there's fast and slow, so you always want to be on the slow side. Okay, make sure you turn it on. But when you turn it on, it's going to spray water. So make sure you put the side shield down. And you see how the water is spinning out, right? Okay. So the wheel is turning this way. So if I put my margin in, it's going to wipe it out. So always make sure that the margin is pointing down, so that the wheel is just polishing the external surface of your provisional restoration. And when you're polishing, make sure that you always have some amount of pumice on the area that you're polishing. So you go ahead and just lightly do that. And you want to go ahead and do the proximal surfaces as well. Okay. And for the occlusal, what I do is I like to use the side of the wheel, and that will take care of the occlusal. Now here's my central groove. And there's my groove right there. And there's my groove right there.
Are you applying any pressure?
A little bit of pressure, just light pressure. But don't do too much because it will wipe away occlusal contact and it will create an open margin. You notice that my margin is what? Always facing down, okay? Down and away. And so you just need to make sure you have a little bit of color. And what this does is this makes it a nice glossy shine, gets rid of that little matted finish. And that's all you really need to do, is just run it a little bit. Let's wash that. Let's come over here. So you have a nice shiny Provisional. The reason why it looks discolored is because I use blockout resin.
Right.
But if I didn't use that and I use flowable, I would have a really nice polished.